Additional from the University of South Africa. I will, what should I call it to introduce your panelists? Fine, okay. Okay, let me hand over to the chair who will introduce the panel, and then we will take proceedings from there. Thanks, Prof. Just what the microphone. Yeah, I'll bring them. Just one announcement. There is an iPhone here, which is looking for its owner. You can come to me, please. Okay. I'll get the microphone. All right. Okay.
Thank you very much. Attention, s'il vous plaît. I hope, you know, okay. All right. Thank you very much. This panel it takes off essentially from where Andre's presentation stood in the previous panel, and it's concerned with social policy responses to the COVID-19 pandemic. Lessons from Africa. We have 4 presenters. The order of presentation has changed from what you have in the program, but the number of presenters is exactly the same thing. We have Kate Mehra, you know, who is from the London School of Economics, and she'll be presenting on the African informal economies and the will to protect. This will be followed by Clement Chipenda from the University of South Africa, who will be presenting on social policy responses to COVID-19 in Zimbabwe. And then this will be followed by Newman Tekwa from the University of South Africa on COVID-19 gender and social policy responses. And then finally, we have Julia Chukuma at Open University in the UK, COVID-19 and inequalities in accessing education and healthcare in Nigeria. Each of them will have 18 minutes to present. Then after the presentation, Georgie Chikata will, from the School of Oriental and African Studies at University of London, will give overview and insights and responses, you know, as a discussant. I'm hoping that we will be able to have about 25 minutes for the discussion. You will be standing between you and the lunch. So I know there are people who like to give preambles to the questions and say they agree with the last speaker. If you agree with the last speaker, don't tell us. Okay. Boyle, we will call, you know, for, you know, probably 5, 7 speakers. Whatever the number of questions you have, shake through the jar and select one question. If you ask a second question, I will interrupt you. Okay, select one question and you have 1 minute to ask the question. It's a conference. Okay, it's a watering hole. There is time in the evening. Normally the program will end at about 5:30. You can sit on the, you know, at the seafront there and have a chat with whoever you want to have a chat with, pick up issues with the presenter. Let me welcome you to this session. As just a brief interjection, I think yesterday, I'm not sure we did enough to honor our last three executive secretaries, Godwin Murunga, Ebrima Sal, and Adebayo Olukoshi. Ebrima was in the room yesterday. I don't know if he's around today. I would like to ask for a round of applause for each of them for the credential we have, because it's a classical example of intergenerational transmission and institutional memory. Thank you very much. Kate.
Good morning, everybody. I'm really honored to be here today to talk to you, and I'd like to thank Codestria for pulling together such a fascinating group of people and set of issues to really look at this COVID arrangement. I don't see the slides coming up. There are supposed to be some slides. So what I'm going to talk to you here about today is to look at the whole issue of how social protection is penetrating into the informal economy, and to think about what the COVID moment can tell us about that process. But there are some slides that are supposed to go along with it. I think that the core issue I want to look at is the extent to which the COVID moment revealed things to us, or in fact distorted our understanding of things in order to create a framework for perpetuating the old order rather than clearing it away. Now, this is how technology helps us to confuse things rather than improve them, which is very topical for the presentation that I want to make. I think the core issue that I'm going to be looking at here are the ways in which the COVID narrative regarding social protection and the informal economy has actually distorted and mystified our understanding of what's happening, what social protection is doing, and why the informal economy, particularly in the African context, may or may not need social protection, particularly with regard to the emphasis on digital social protection and the pressure under COVID to ensure or to insist that African countries should develop digital means of social protection, developing the infrastructure, the internet connections, the digital payment systems, the social registries, all of which are very, very expensive in order to reach people in the informal economy. I'm trying to stall, but things are not looking good. Okay. So the issue that I'm looking at here about informal economies and the desire for digital social protection, I'm drawing on the idea of the will to protect, which connects with the idea of the will to improve, put forward by Tanya Lee, talking about how donors implement a will to improve, which turn development ideas technical. I'm not getting my distance from this microphone quite right. Okay, so, all right. So one of the things that's happened under COVID-19, and I hope my time is starting from now, is that it has intensified the social protection agenda in Africa. And that agenda is nothing new. The social protection agenda that social protection should be made available to the poor in African countries has been around for over a decade, really marketed heavily under what Jimmy Adesina has referred to as policy merchandising, which isn't necessarily connected with what people require or what states want to do. So what has been put forward under COVID was a kind of best practice of digital cash transfers. And this expanded rapidly across Africa under COVID. By September 2020, already 153 measures had been implemented across 43 African countries. using a significant measure of digital cash transfers component. And unlike in the West, 86% of these COVID measures were targeted at the vulnerable and the informally employed, not just at people with formal employment. But these cash transfers have a tendency to emphasize very minimalist types of transfers amounting to 6 cents per day per person in Malawi, 31 cents per day per person in some of the Kenyan earlier cash transfer programs, where the poverty line is $1.90 per person per day. So with the reflection here is about what is the epistemic moment telling us here? To what extent does this represent a kind of social double movement of protection for informal workers? And to what extent is it a process of remoralization of neoliberalism in order to serve other ends? So the question is to think about how COVID has transformed the social protection agenda for better or for worse. Okay, so there are three contradictions I want to concentrate on here. The first is the intensive argument that African informal economies are uniquely vulnerable because they're so large and people are poor and therefore require intensive social protection. And yet, as many of us know, the fatalities, the incidence of COVID in Africa was extremely low. So how can Africa have the largest informal economies, but the incidence of COVID is very, very low if informal actors are uniquely vulnerable? The second contradiction is that informal labor has been reframed away from the idea of surplus labor. These are not workers who are just surplus to the needs of capital, and towards this idea of essential workers. Yet the policy response to supporting informal actors is minimalist cash transfers rather than trying to promote decent work. Okay, for essential workers, you would think that they deserve better than 6 cents per person per day. And then the third contradiction is that the parts of Africa with the smallest informal economies and the best digital social protection systems are associated with the highest rates of COVID mortality and vice versa. So if digital social protection is best practice, why is it that where that best practice is best practiced, COVID death rates are higher? So as is widely known, Africa has the largest rate of informal economies. 72% of the non-agricultural labor force work informally across the continent, 77% in sub-Saharan Africa. And the push for social protection is, maybe I should put this a bit lower. The push for social protection is very much a donor-emphasized thing. As I said, highlighting the extreme vulnerability of informal workers who have to earn every day what they will eat, so they're under risk of dying of the virus or dying of starvation if they try to socially distance. But if we look at the data show an inverse relationship, a bit along the lines of what Professor Makende was saying, an inverse relationship between COVID mortality and levels of informality. And this is using publicly available data. And the map there shows that the darkest color there is the size of informal economies. And you can see that the main part of Africa, if you take out North and Southern Africa, has the highest level of informality. And here is a picture of the incidence of COVID deaths. And you can see once again, the central part of Africa, outside the North and the South, shows the lowest level of COVID deaths. And I've told this story before at another conference that some of you will have attended, so I'll just breeze through the issues here. If you use ILO figures and the World COVID Report figures, you can get a clear idea. Africa has the largest informal economies, but although the African continent accounts for 18% of the global population, they accounted for only a tiny fraction of COVID deaths, less than 4%. And if we break that down to deaths per million, because it's not just an issue of lower populations, barely, not even 10% of the level of deaths per million as in the Western countries. And it's not because their social protection systems were good. Social protection systems are also very weak. If we look at Africa itself, there's also variation in the levels of informal economies, but also variation in the levels of COVID deaths. And we see the same pattern. In Southern Africa, only 36% of the population or the non-agricultural labor force work informally, whereas in West Africa, it's 87%. But if you look at the deaths, the COVID deaths, 43% of COVID deaths were in the region of Africa with the smallest informal economies, and only 4.7% in the region with the largest informal economies. And you can see a similar pattern in terms of deaths per million and levels of social protection. So there are some people who argue this is just a story of poor numbers. Countries with large informal economies tend to have weak states, and they're not any good at gathering statistics. South Africa is certainly much better at gathering statistics than many other parts of the continent. And this bred a set of what are called excess death models that looked at how many extra people died during COVID in order to adjust statistics. Two famous ones were by The Economist and a study by Wang et al. Published in The Lancet. And both of them concluded that African excess mortality during COVID was 14 times reported COVID deaths. But another study published by Kabore et al. Also in The Lancet argues that this is highly implausible, and that if you look at the statistics, they do not, this excess death calculations don't correlate with known activities. The 14 times the death rate would mean that almost 500,000 people died of COVID in West Africa, which is 50 times the number that died of Ebola, and yet nobody really noticed. And over 1 million would have died in East Africa. And again, there were no apocalyptic news reports of deaths through COVID in East Africa, the way there were in Southern Africa. So the question is here, whether the excess deaths, Kabore et al. Then explained that the excess deaths, if you use African data well, were maybe 2 to 3 times the level of official figures. And the figures I'm using here are about 1.5 to 2 times the official figures. So the question is, why so much emphasis on the extreme vulnerability of informal economies if the evidence is in the area with the largest informal economies, COVID deaths are lower? Now, Bill Gates said that 10 million people would die in Africa by the end of 2020 because of poor health systems and large informal economies. Even with all this data available, they continue to spin the same narrative. And I think we can understand better what's going on by thinking about the shift from the notion of surplus labor to the notion of essential workers that has accompanied this emphasis on the vulnerability of informal economies and the need for digital social protection. This idea of surplus labor was how social protection for the informal economy was first pushed by James Ferguson and others with the book Give a Man a Fish, Tanya Lee as well, who argued that informal economies represented people who were surplus to the needs of capital. They were just irrelevant to the capitalist system, to the global economy. But under COVID, suddenly informal economies have been relabeled places of essential workers. The people who clean our cities, clear the garbage, run the transport systems, distribute food, etc. And that we need to protect them so that they continue to run these systems, which serve especially the poor areas, but also the centers of the cities. Some have said this is a revalorization of informal work under COVID, but the question is whether they're being revalorized as workers or revalorized as relevant to capital in new ways revealed by the COVID context. So to understand what's going on here, it's useful to take a closer look at the concept of surplus labor in Marx. And surplus labor for Marx is not just people who are irrelevant to capital, but rather involves the expulsion of people from circuits of capital in order to reincorporate them in different ways within the circuits of capital. So the question is, what are the new ways that this these large informal economies are being reincorporated into the global economy. And the second issue is the emphasis on secondary accumulation. Okay, accumulation is not only about primary accumulation under production, but secondary or indirect accumulation, through which a social reproduction can be used as a form of accumulation, a lever of accumulation through things like consumption loans, slum landlords, the company store in mining areas, where the poor are charged extra for very low quality things because they must have them. They must have a place to live, they must have food, they need to borrow money to cover their costs. So in the current context, microfinance and cash transfers actually are creating new mechanisms through which informal workers are becoming relevant to capital in new ways, through interest rates, through marketing of financial products, to create income streams coming through the mechanism of social reproduction. Okay, so here's the shift of from give a man a fish then to a recent ILO report on the importance of essential workers. And there's a growing number of studies of informality as essential work. So thinking about digital connections and pushing digital cash transfers as the best practice for COVID because it allows social distancing, but getting resources to the poor without making them move out and about. Digital mechanisms are a new way in which informal workers are being connected into the global economy. And the pressures for digital social protection under COVID come almost exclusively from the donors. As I mentioned, Jimmy has pointed out that this has involved aggressive policy merchandising, but the issue of the digital connections is even more perplexing if you look at how that relates to the lives of informal workers. So digital social protection, when you examine what's required, is not at all suited to the needs of African informal workers. The areas where they live mainly lack electricity. Over 50% of households across sub-Saharan Africa lack access to reliable electricity. Digital connectivity is weak, especially in the places where poor and precarious workers live. Many of them lack mobile phones. Only a third have bank accounts. And many of them have problems of illiteracy, unfamiliarity with digital systems, lack of documentation to establish their right to social protection. On top of that, digital systems are often incompatible with the state mechanisms, the administrative systems. They don't fit the financial systems. They don't fit the administration of social protection, which then has to be reorganized to suit these imported digital systems, because most African countries are not in a position to create digital systems to fit their social protection structures. So they disrupt the state and disrupt democratic control. And there's the additional problem of rushed innovation in which old data is used, which mean that targeting is ineffective, and there are high problems of exclusion, as well as creating additional risks of private sector and state abuses through poorly understood and poorly accessed digital systems. So digital systems really create a barrier, not only to the access of informal actors to benefits, but to the kind of democratic interaction of the informal workers with the state over how social protection should be distributed. And people are probably familiar with the case of Net1 in South Africa, which was a private digital arrangement coming from the global north, from France, where people's accounts were being levied for products they didn't think they had bought. And there was massive abuse, and they were eventually dropped, and the social protection was distributed then through the post offices. So it's been argued that when you look at the realities of how informal people live, digitization of social protection can do more harm than good. So the case for digital social protection as a practical thing to help the poor is quite weak, but there's a very strong business case for digital social protection. And this has been reviewed in a few articles. Digital social protection is highly profitable to for-profit northern financial and digital providers for the setting up of systems, for the provision of ongoing services, and cross-selling a range of financial products, insurance, loans, etc. And is virtually risk-free because you can just lift the money out of the social protection deposits, the cash transferred deposits, before the recipients actually get access to their own money. Okay, so the protective value of digital social protection looks really weak in that case. And if we look at specific cases, we can see that the protective value is quite questionable, that places with the highest level of digital social protection and the smallest informal economies actually had more deaths from COVID, and the places with large informal economies and weak digital social protection had fewer deaths. So it wasn't a choice between lives and livelihoods. It actually created a situation where digital social protection undermined both lives and livelihoods, and the lack of it was less problematic. So there are a number of reasons why in South Africa, or Southern Africa, we have smaller informal economies, about 36%, well, in Southern Africa, 40% of the non-agricultural labor force. Better digital social protection systems that under COVID were extended to reach 1/2 and even up to 2/3 of the population, and yet the highest COVID death rates, 43% of COVID deaths for a part of Africa that accounts for about 6% of the population of the continent. Now, why did this happen? There were a number of reasons. One is registration problems. These systems were very centralized, hard to access, and difficult to understand, particularly for precarious and informal workers. And that meant that they had to travel to get help to sign on to these systems. So we're moving around, accessing people to help them, or even traveling to urban centers. Southern Africa also had much stricter lockdowns. They closed open markets. They banned street trading for a while in some places and crowded people into supermarkets for food provisioning. And this created conduits of contagion. And finally, the propensity across much of Africa for people receiving digital benefits to cash out, okay, because of unreliable infrastructure, a lack of digital payment systems, and the fact that many people know that when they need that money, they may not be able to get it. So once they get the deposit at that time of the month, they go and cash out right away. So you had scenes like this, despite the high-tech dissemination of social benefits, scenes of people crowded into payment centers to cash out, which was not ideal for social distancing. And here's a comment from an interview of a variety of different people in South Africa about what happened. And they talk about how they have to wait in line, sometimes from the night before, and there's pushing and shoving. And it's very difficult to get the benefits. And there's a lot of crowding together and queuing. So in West Africa, we have the reverse situation. Very few people were covered by social benefits, less than 15% across many of the places surveyed, but also very much less digitized. In Nigeria, social COVID payments looked more like this rather than neat payouts from cash machines. But they had much more diversified forms of social provisioning, cash transfers, in-kind support, utility subsidies, school feeding programs. Open markets were left open. And this limited vectors of contagion and provided for much more diversified centers of interaction, better social distancing. Open markets were in the open air. People were moving around. They weren't crowded together. You also had more digital innovation from among small businesses and from open markets. In Lagos, some markets had carried out digital orders and deliveries of market goods through the open market. Many businesses used WhatsApp and Instagram to create a remote delivery framework. You can order, pay online, and then use a motorcycle taxi to deliver goods. So there was a lot of innovation. Tailors, markets, all kinds of small business provisioning. So last slide, what are we getting out of this epistemic moment then? Digitized support for informal workers. Is this a social movement to protect the informal finally coming up under COVID? Or is this a mechanism for turning precarity into a channel of accumulation for the global north? And Bio said yesterday, when big changes are afoot, it can produce monsters. And I think the digital social protection agenda needs to be scrutinized for the extent to which, instead of being a mode of protecting the informal, it is producing a new monster. So it's less about worker needs and about realities, and much more about the logic of secondary accumulation and the business case for social protection for the global north, not the support case for informal workers in Africa. It promotes systems that are more geared to profiting from precarity than from supporting precarious workers, and maybe even transforming precarity in order to improve people's livelihoods. And I think that the lesson to draw from this under COVID is the need to focus more on existing African agendas of transformative social protection and how that can be advanced. Thandika Kandawire was one of the primary authors of that, and Jimmy and many others have pushed it forward to look at genuinely transformative forms of social protection, rather than assuming that if it's digital and targets informal workers, there is some transformation afoot that will be useful. Thank you.
Afternoon, everyone. I think my slides have to come up. I just want to thank Codestria and Professor Adesina for this opportunity. The title of my paper is Social Policy Responses to COVID-19 in Zimbabwe, and there are reflections on fostering what is termed a transformative social policy agenda in a post-pandemic context. So when we look at Zimbabwe, no, it's not that one. So when we look at Zimbabwe, yeah, that's the one. Okay, thank you. So when we look at Zimbabwe, you find that just like other countries in the world and globally, you find that it was not spared from the pandemic. And in the slides there, I present statistics up to date, which show that almost 6,000 persons lost their lives, and about 265,000, they were confirmed positive cases. So although the figures are a bit on the high side, the issue there is that COVID-19 was not as catastrophic as was initially feared. And I think Kate has pointed out to some of these issues, because I think there was the fear that Africa would be affected because of underfunded healthcare systems on one hand, large immunocompromised populations and other factors, and also the large informal working sector, and also the living conditions of Africans. So it was not as catastrophic as was feared. But we are now in a period of a post-pandemic context, and what is arising is that it has raised the need for critical scholarly engagement as we reflect on lessons learned from the pandemic, and we are looking at what governments did, what civil society did in response to the pandemic. And it also presents us with an opportunity to reflect on the future of what maybe we need to do, maybe to respond to crisis. And we do this at least from a social policy perspective. So it is against this background that my paper is actually crystallized around looking at the country's social policy response to the pandemic on one hand, and also the prospects that are there for fostering what I term a transformative social policy agenda in a post-pandemic context. So my paper is framed in the transformative social policy framework And this is in a background when we look at a reignition of interest on the social policy paradigm in a development context. And you find that the issues that are arising is the proliferation of endogenous Afrocentric knowledge. And this, in this context, we are seeking to really understand and also the challenges that Africa is facing, which we argue that they are unique, and also not only to understand them, but also to provide practical solution. And the second focus is what I see as a critique of conventional social policy approaches, which are predominant in the African context. And the argument there is that when we look at the social policy paradigm in most countries, it's largely narrowly defined, it's rigid, it's top-down. In most contexts, it's externally driven, and it lacks the capacity to deal with systemic and idiosyncratic shocks and crises. And I think the COVID-19 pandemic actually brought this into perspective. I just give a brief background on the roadmap to the COVID-19 response in response to Zimbabwe, and focus is on government actions and also the bureaucratic apparatus that was put in place to respond to the pandemic. So you find that when we look at the response to the pandemic, what stands out is that it was built around the already existing social policy architecture, which over the past 2 decades has undergone a number of changes. So one of the first actions of the government in this context was to declare it as a national disaster, and the legal instruments that were used in the country were statutory instruments, which were preferred as they were not really bureaucratic and they were easier to implement if you compare with the alternative that was there to declare it as a national disaster. So for the government, the immediate focus there was to try and lock funding. And this entailed focusing on projects that were classified as not being of priority. And there was also the scaling up of responses. And this came about through the deployment of additional resources. So just like other countries, we find that issues of national lockdowns, the restrictions of movements, regularizing the operations of business as well as the informal sector were actually part of the response. I won't get into that too much. So when we look at the country, you find that there was a tiered system of levels of lockdown from level 1 to 4. And I think this was pretty much similar to the South African context, with level 1 representing low COVID prevalence and spread, while level 4 represented high COVID prevalence and low health system responses. So you find that in February 2020, there was the development of the National COVID-19 Preparedness and Response Plan, valued at 26 million, followed up by the setting up in March of that year of an interministerial task force on COVID-19. And several ministries were represented there: Health, Home Affairs, Defense, etc. We go on to May to July 2020, the setting up of the COVID-19 response operational plan, and also the COVID-19 intersectoral operational plans. And this was followed by a merger of these different initiatives and committees in what was termed the National COVID-19 Response. And it saw the merger of the different organs to respond to the pandemic. Critically important at this juncture, I think, is the COVID-19 economic recovery stimulus package that was unveiled. And if you look at the slides there, it highlights the different support that was given to the different sectors as a response to the pandemic. And what is worth noting is that it comprised about 9% of GDP. So you find that support was not only restricted to social protection or health, but also there was agricultural support, there was support to the mining sector, there was support to the arts sector, etc., etc. So this just highlights the breakdown in terms of funding for the response. And this is a continuation that just highlights the objectives of this package to provide support to the productive sectors, to protect employment, to provide a recovery mechanism for all the micro enterprises and also households that were actually affected by it. So this just highlights the objectives of the package that was unveiled by the government in response to the pandemic. So when we look at the social policy response, specifically in the Zimbabwean context, you find that it largely comprised of food mitigation initiatives, there were cash transfers, there were healthcare interventions. This is in addition to the other forms of support that were highlighted in the stimulus package, which I will not go into. But for the purposes of this presentation, I'm looking at food mitigation, cash transfers, as well as health interventions. So when we look at the issue of food mitigation and also cash transfers, it was facilitated through the Department of Social Development. And the focus there was to support vulnerable groups through the distribution of food. And there are statistics there of the support that was given to the rural districts and also extended to the urban districts and the number of households that were supported in the urban areas. And the extension of the support, like in January to April 2020, the government reported that it had supported 63,000 households, and focus was on the country's poorest districts who were said to have benefited. And we see a report in the 2020 national budget that an additional 10 districts were also incorporated in the food mitigation interventions. So the primary instrument that was used is what I indicate there as being the COVID-19 emergency cash transfer program, which was valued at about 550,000 United States dollars a month. And later it was upgraded with additional funding in the budget. And in Zimbabwe dollar terms, it was about 2.4 billion. So what did it entail, this additional support? The objective was to provide food to 1 million vulnerable households. And initially, the idea was for it to exist for about 8 months, but it was later reviewed and it went on for 12 months. And the value of it was about $300 a month. That is the Zimbabwe dollars. And it was provided to vulnerable households. And due to issues of inflation, etc., it was continually being reviewed. There was also the support that was provided to micro enterprises owners, and the figure that was provided there was about 200,000, because it was felt that they also needed some support because their operations had been disturbed by the pandemic. So in addition to those, there are also a number of health interventions which I will briefly highlight. And you find that, as I indicated in the economic stimulus package, there was also that provision for health support, specifically to rehabilitate hospital infrastructure. And specifically, there was the upgrading of central, provincial, and also district hospitals, the construction of isolation centers, the procurement of protective equipment, staff recruitment, and also the purchase of essential equipment, among other initiatives. And I think in this context, I'd just like to highlight that this was considered essential, especially in a context where the country had for years had an underfunded public health system and dilapidated infrastructure when it came to hospitals. So this was considered as important. And in addition to this, they were seeing the need to recruit more personnel. The figure given was 4,000, and the creation of additional posts, about 200 in the public health sector. In addition to this, there was the provision of incentives for frontline workers, including $1,000 once-off payment for those who had contracted or died from COVID. So this allowance was extended to other government workers. In this slide here, I won't dwell much on it, but it also indicates the support that was given to frontline workers in the public service, which included allowances, and it also included an increase in salaries and also professional support for those who fell sick or needed to recover at home. So this entailed the healthcare interventions that was there. So when we reflect on these responses, in the paper, I argue that the cash transfers and food mitigation initiatives were actually inadequate, and they were plagued by challenges in selection processes which were unclear. They excluded the poorest, who did not have access to things like mobile phones, bank accounts, or money wallets. The other major challenge was that the cash transfers were were paltry and were insufficient. And we're talking of a country that has got one of the highest hyperinflationary environments in the world. So at some point, the monthly transfers were only worth about 3 loaves of bread. The healthcare system was exposed as being underfunded and unequal. And we saw the elite preferring to utilize the private healthcare system. And this is in a context where we find that the responses were founded upon decades of underfunding in both the welfare and also the public health system. In this slide here, I just want to highlight that from the Auditor General and also the Parliament Public Accounts Committee, they also raised some concern in terms of the responses to the pandemic, in which they were saying that the processing, for example, the processing of payments for beneficiaries, they identified some fictitious identity numbers, some suspicious names, and also insufficient addresses, and also irregularities in identifying beneficiaries, lack of records, failure to make follow-ups to verify the existence of beneficiaries, and also to see if the allowances had actually reached the intended beneficiaries. On the other hand, there were accounting malpractices, and some of the beneficiaries did not actually receive the payments, but there was no follow-up in terms of this. So this has been flagged by the Auditor General and also the Parliament Public Accounts Committee on COVID-19. In addition, you find that the government itself has actually made some observations, if you read through its strategic and policy documents, that the COVID-19 response was actually had challenges. And also you find that if you read through the fine text in the budgets of the country, you find that there were challenges. For example, they highlight that the welfare regime as it currently exists in the country is not adequately supported. The social services are weak, there's weak coordination, there's poor monitoring and evaluation, etc., etc. And this is actually interesting that the government itself actually acknowledges that there are challenges, and it's not often that we find the government actually indicating for this. And it is upon this basis that you find that it has come up with some points of action to actually deal with the weaknesses in the social policy architecture. And I just want to highlight that in terms of its 5-year medium-term plan, it actually acknowledges that there are these challenges. So there is a list of areas that it wants to improve on in terms of support, especially in the social services and also in the health services. I won't go into that because of time. So what are the important lessons that we learn from the Zimbabwean experience in terms of the pandemic? And I think I'll rush through this. Firstly, the urgency to revamp and also to realign policy initiatives, which have been shown as having challenges. And the objective here is to ensure that social and economic policies are in tandem. And this is an underlying objective of the idea of transformative social policy. And equally important in this context is ensuring that their financing through progressive and that there is financing of social and healthcare initiatives through progressive and sustainable instruments. A need to return to the wider vision of social policy, which is not only crystallized around the idea that we must provide welfare, but also with the idea of enhancing the productive and reproductive capacities of beneficiaries. And when we look at the social policy response in Zimbabwe, we find that the trajectory towards agrarian welfare is there. And I think this provides an important example of the way that we should be thinking, and also the idea around having a national healthcare insurance. There's also the imperative of rebalancing state market citizens and societal relations with the adoption of transformative social policies that are based on a fair fiscal compact. The need to revisit social contracts, that is if they exist, and also to ensure that they are fit for purpose and are able to sustain a transformative agenda. We also need social policies in place that have an underlying objective, that is to reduce inequalities on one end, to foster solidarity, and also build resilience against future shocks and crises. And lastly, and most importantly, I think for African countries, there are lessons to be learned there from the social policy response. And the need to have social policy regimes which do not have a narrow vision that is characterized by external policy merchandising, far removed from local realities, or dominated by the neoliberal agenda and the market logic. This, if we reflect on the social policy responses, has made social policy to be palliative rather than transformative, and is attributable to some of the failures that we have witnessed in a crisis context. Thank you.
All right, let me begin by thanking Codesia for organizing this conference, and also my supervisor here, Professor Juma Desina, for organizing this panel. My title of presentation, I think, can I request that, oh, it's already there, okay. My title for our presentation is illustrate COVID-19, gender and social policy response, questions from Mauritius and Zambia. I would just briefly give you maybe just a brief introduction, then I maybe discuss some archetypes of social policy trajectories in Africa. Then also look at some social policy architectures at COVID-19, then look at COVID-19 and social policy responses before I move on to conclusions, recommendations, and way forward. That's a background to my presentation that I'm using a gender lens to examine COVID-19 social policy responses in 2 African countries, Zambia and Mauritius, who happen to have got their independence coincidentally in the 1960s, beginning with Zambia in 1964, then Mauritius in 1968, and also it happens that these 2 countries recorded their first case of COVID-19 on a similar date, which was the 18th of March 2020. These 2 countries, which I'll be discussing with today, are part of the Anglophone Southern African cluster within the continental-wide gender equitable and transformational policy post-COVID-19 Africa, a research project which is hosted by the Institute of African Studies at the University of Ghana. GETSPA, which is whose principal investigator is here, Professor George Carter, and also I've seen also Nana, who is also here, one of the principal investigators, is a 3-year multi-country research project funded by the Open Society Initiative. Okay, let me move with you. Okay, just move the slides. Okay. Oh, this one. Oh, I see. Okay. Okay. It's a 3-year multi project, which is maybe funded by the Open Society Initiative in Africa, and actually hosted at the University of Ghana. Specifically, GETSPA seeks to understand the value propositions underpinning social policy, the assumptions of the state, market, and society, the interface between economic and social policy, and the concomitant welfare outcomes across gender, class, and space. With COVID-19 stressing the importance of social policy in times of COVID, year one of the GESPA project, they mapped out country-specific social policy landscapes at the eve of the pandemic and their trajectories from the colonial times up to the COVID time. Okay, so what do we find? Okay, I'm not seeing my diagrams are not showing there. Okay. Okay, what we find, maybe I just use the strategies here. What we found in the year one is that African social policies progressed towards vulnerability due to the neoliberal rolling back of the state. And this was also underlined by the underlying ideologies which tend to reinforce inequalities, including those of gender. Besides that, there are also conditioning factors within domestic, maybe within the countries, such as high debt ratios, and also gender forms of vulnerability, which tend to increase the high vulnerability of countries to shocks. So eventually, when COVID-19 came, most countries were found to be very vulnerable to any form of risk or any form of hazard, including epidemics like COVID-19. Then, okay, even though most countries were found to be vulnerable within the African continent, but there are also some few exceptions, in which these countries tend to be more resilient to shocks. For example, can we count a few countries like Mauritius? We can also count countries like Cape Verde, whose social policies were not so narrow as we found in many of the African countries. These countries, together, from much of their social policies were actually underlain by gender equitable distribution of resources, and they also tend to challenge hegemonic ideologies, including masculinities. Then, besides that, also these countries they also tend to establish institutions which tend to provide fallback in case of crisis. So eventually, when COVID-19 came, the experiences with the pandemic was not comparable to many of the countries which we found on the African continent. Okay, maybe I'll be able now to see this slide. Here I try to highlight some of the social policy architectures at the eve of the pandemic in the two countries which I'm focused on, Mauritius and Zambia. When that in Zambia, the country was very highly vulnerable due to its residual neoliberal social policy. Mainly, if you look at social policy in Zambia, it was mainly targeted, poverty-focused, and donor-driven, which actually mainly modeled around the poor relief model, which are reminiscent of the 18th century Europe. If you look at those who might be familiar with Zambia, if you look at what is called the Zambian Social Case Transfer Program. Besides that, the state case transfers were very minimalist and tend to use what are called social registers. I think Kate talked about them. These registers tend to have a 50% coverage gaps, especially in terms of coverage of those people who might be in need of assistance. And this is actually a core feature of social policy under austerity. As a result, in such a social policy architecture, women tend to shoulder much of the burden which has been offered by the state. In addition to this, looking at the underlying conditions within the economy, they find that mainly Zambia's economy had a limited transformation, a high informal economy, in which 90% of the informal workers are women and lacking any form of social protection. Then also Zambia is also characterized by a very high debt ratio, which maybe it currently is now reaching $25 billion. And also results that maybe the country had a limited fiscal capacity to respond to emerging livelihoods and also a health crisis which was caused by COVID-19. But if you compare with Mauritius, which represents the second, but maybe very few countries, it had a very generous investor tax-funded social policies, which with very generous benefits, which tend to address risks across the life cycle. One feature that maybe if you look at Mauritius by 2019, its expenditure on health it reached almost 27% of the GDP. If you can't compare such an approach to social policy with what we found in Zambia, where much of the state expenditure on social issues like health was actually on the decline. Compared to what we find a minimalist approach to social policy, then that Mauritius is the inexpensive and generous family benefits, which included universal medical care, non-contributory pensions, public care facilities, among a vast array of benefits. This was in addition to a very diversified export-oriented economy, which tend to create more jobs for women, resulting in many of the women having employment insurance, which tend to protect them during the COVID-19. This in addition also to a very low GDP debt to GDP ratio, resulting in maybe in the state having a capacity to respond to economic shocks which actually, as you know, have been engendered by the COVID-19 pandemic. Okay, so looking at the social policy responses, the infrastructure and their gendered outcomes, find that mostly the social policy responses by countries actually dependent largely on the existing social policies. Since we've seen that Zambia had a very minimalist social policy, its approach to its responses to the pandemic was largely rudimentary and temporary, and mainly in the form of cash transfers and food relief. I think Clement has just talked about that. We have what they've termed the emergency COVID-19 cash transfer program, but its design was based on the social cash transfer program. The social register on the social cash transfer program, and the beneficiaries of the COVID-19 pandemic were actually drawn from the social registry. That resulted that in many of the people who might have needed assistance were actually skipped just because of the design in which these social policy approaches are used in countries like Zambia. So maybe that's the second point, where the large coverage gaps have been also witnessed, with only 16% out of 43% of the households that need assistance received help. This was also due to the lack of state capacity. This was accompanied by mere gap transfers of around 400 kwacha, which if you translate, it is equivalent to around $18 per household, and were largely donor-driven with very little support from the state. Just because of the nature of the social policy which was existing in Zambia, found that there were no provisions which were made for informal workers, despite the huge informal economy, resulting in many women bearing the brunt of the COVID pandemic. If you compare the experiences of the COVID-19 in Zambia to that of what we find in Mauritius, you find that Mauritius actually head into the coronavirus storm. Okay, let me go with you. Okay, it heads into the coronavirus storm with a very strong social welfare buffers, which included universal access to health, employment-based social insurance, with women constituting a greater proportion of those who were in employment. And if you compare countries which are between these two countries, the response to COVID-19 was was much quicker in countries like Mauritius as compared to Zambia because of the underlying policy infrastructures. Mauritius also involved the universal coverage, which was the universal coverage by Mauritius, which was from the state, targeted only 7,900 households compared to 1.2 million households who are in Zambia. For that, if you compare these two figures, for that there were very few people who were vulnerable to the pandemic in Mauritius as compared to the numbers of people who might need assistance in Zambia, just because of the state of the social policy between the two countries at the time of the COVID-19. Additionally, found that in Mauritius there was a statutory guaranteed income disbursement benefits, which we term here employment insurance, with the majority of these beneficiaries of these insurance cover being women who also were employed in the formal economy. So if you compare this with what you find in Zambia, just both high informal economy in Zambia, and women being much of the people in the formal economy, but the Zambian women were more vulnerable to the pandemic as compared to what we find is compared with women in Mauritius. Then one thing about Mauritian social policy response was that it also embedded provisions for informal economy through the self-employment assistance program, where the government also tried to assist those workers who were found in the informal economy to also protect them from the economic shocks of the pandemic. Okay. Then what do we learn? What are our conclusions, our recommendations, and way forward? we find that due to the different in the depth and breadth of social policies that existed prior to the pandemic, this tended to aggravate or ameliorate the plight of women under COVID-19. So maybe if you're comparing between Zambia and Mauritius, that find that the Zambian social policy was very minimalist and very thin, and this tended to expose much of the population, including women, to the vagaries of the pandemic. But if you compare to what we find in Mauritius, just because of its robust social policies, Mauritius actually had actually cushioned much of its people through its expanded social policy, which is also universal and also so generous as compared to what we find in Zambia and many other African countries, which tend to have been affected by the neoliberal social policies. Whereas Mauritius required less incremental spending per head for an equivalent health and economic impact, this was not the case for Zambia, where many, particularly female-headed households, were exposed to the vagaries of the pandemic. What our arguing is that your social policy is also critically important in addressing or in responding to pandemics or to hazards, for example, pandemics. If you have a very robust social policy, it means in the case of a pandemic or in the case of any hazard, the requirement by the state to add to what is already existing becomes less, but with a higher impacts in terms of health and welfare outcomes. But in a countries like where the social policy is very thin, like in Zambia, despite the country lacking the fiscal capacity to respond to the pandemic, this was also worsened by very limited state capacity and also a very minimalist approach to social policy. Then we also try to argue that we can use our social policy as a catalyst for diversification and the transformation of African economies. So if we find that maybe in the Zambian case, due to the lack of transformation in the economy, with the country relying with almost over 70% of its exports coming from the export of copper, the Zambian economy is still untransformed and hasn't created much economic opportunities for the majority of people, including women. But we can actually use our social policy to catalyze the transformation of economies with gendered benefits for women, as we have seen in Mauritius, in which it tried to transform its economy towards an export-oriented one, resulting in many women being employed in the formal sector and also having employment-based social insurance. Then ideologically, we advocate for a shift in the way we approach social policy, mainly the shift from the neoliberal approach to a more expansive approach to social policy, and also including a shift in also in the gender ideologies, which tend to inform much of our social policies. And we also advocate for tax-funded universalist social policies which address risks across the life cycle as we build towards the post-COVID-19 social security reconstruction plan in Africa. Thank you.
Good morning, everyone. My name is Julia Chukuma. I am a lecturer at the Open University in the UK. And I'm very grateful and excited to be here at Codesria. It's nice to be in Dakar. The weather is better than in London. But I've already learned a lot in the panels yesterday and today. So it's really great. And thanks to Prof for the opportunity to be here as part of this panel. So I want to speak today about COVID-19 and related to the experience of Nigeria. Particularly looking at inequalities in accessing education and healthcare. And just to give some background, my own research looks very much at healthcare systems. So I looked at the UHC healthcare reform process towards universal health coverage in Nigeria. So this work is preliminary work, ongoing research with a colleague at the UCL, Lindsay Robinson, who focuses on educational inequalities in the Nigerian context. So when the pandemic hit and having read what's going on in other parts of the world, of course, we started becoming very interested in understanding how COVID-19 also impacted access to social services, especially healthcare and education in the Nigerian context. where we already know that health and education inequalities are very widespread and rampant. And I think what we were particularly interested in, though, is to reframe or understand COVID-19 not just like another outlier that creates or potentially exacerbates some of the existing inequalities, but really to question maybe actually COVID-19 is just showing us what's wrong in the first place with a system that produces so many inequalities. So our framing of COVID-19 is really to say that it's not like neoclassical economics would suggest, just this external shock to a perfectly functional market economy. And we really do take a step back and would argue, like many would, that like COVID-19 actually needs to be understood as just a way of like highlighting to us all the things that are actually wrong with the way that we organize many of our economies. And so a lot in Marxist economic theory really highlights to us that like the capitalist system as it's structured is inherently going to produce crisis, and COVID-19 is just one of these crises. I think whether or not we understand COVID-19 as an external shock to a perfect system, or more or less, or more so as a manifestation of a system that's in crisis itself, that will also then influence the response of governments, the response that we request from our governments, and so on. So we try to single out certain elements to highlight why we do think that COVID-19 is a crisis of capitalism. And I think many of the speakers, especially in the morning session, but also yesterday, have highlighted and the issue around the unfair distribution of vaccine, right? Vaccine apartheid. And really, I think capitalism and imperialism are so closely linked in its first place. And the pandemic made that really very clear, that we do live in a world that is not equal, that we have inbuilt injustice and bias towards the global north, insisting on its superiority and continuing putting into place ways, terms of trade to maintain this order. And I think the vaccine distribution, the lack of solidarity and so on, made that very abundantly clear. And I also want to highlight, and again, that came up in this morning's presentation as well, is that like capitalism, as it is being presented to us, allows for very quick flows of capital flows. Finance is very easily pulled out of settings, but we have this massive restriction to actually movement of people. And I mean, I just have to mention, of course, the shameful policies of the European Union, as well as the UK hostile environment and so on, that make it difficult for people to migrate legally, while at the same time, during the COVID-19 pandemic especially, we saw this reduction and outflow of financial flows from African countries. And UNCTAD estimates that this was at the order of 16%. A second element here to highlight is also, and I mean, that came up just in Kate's presentation right now, and I really agree with this idea that we conceptualize value in a quite flawed way under the capitalist, under contemporary capitalism. So during the pandemic, sitting in London, of course, like people working in banks, insurance companies, added much less value to everyday life, while we were really relying on garbage collectors, people providing care, healthcare, people working in retail, assuring that food supply chains don't break down. And also yesterday mentioned, of course, in countries of the global north, we see that who is in essential jobs is a category that's like highly gendered and racialized. And many Black and brown people, migrant workers, women, expose themselves to a much higher risk of COVID just by virtue of having to do a job that was considered essential. Another element is really that like we've seen like many more billionaires like making the list during the COVID-19 pandemic because the capitalist system as it presents itself is creating winners and losers by default. In a direct consequence, many places of the global north, but also across the African continent, other countries in the global south, we saw uprising, people protesting against food insecurity, people protesting precarious and informal work, and people protesting real wage stagnations in many places. And I mean, the most obvious maybe really is that COVID-19 itself is a consequence of how we produce and consume. So not a pandemic that is linked to climate destruction and environmental destruction in the first place, where we see spaces of animals crossing into spaces where humans live, that led to the emergence of this global pandemic. So now turning to Nigeria, and again, the emphasis, like depending on how we see or how we conceptualize COVID-19, the response will take a certain shape or form. In Nigeria, a low number of cases were reported, not that many deaths as well. But not only the direct consequence, one other consequence of COVID wasn't only like the deaths related to COVID, but of course the global economic recession that followed. And in Nigeria, we saw GDP contract by close to 2% in 2020. As a consequence of that, government revenues decreased massively. Nigeria concretely experienced a double blow because of its still dependence on oil as a way of funding its budget, and directly also in the immediate aftermath of the COVID-19 pandemic, we see this increase in food prices. Just shortly, I'm not going to spend too much time with this, but like it's the federal government, state governments in Nigeria who are responsible for all the non-pharmaceutical interventions in Nigeria. So like in many places, the Nigerian government too, like imposed lockdowns in certain places and at certain times. We saw mobility restrictions in terms of school closures and interstate travel bans. And just to highlight, the first study showed that like more or around 30 million pupils were reported to not have attended schooling over a certain period of time during the first wave, at least, of the pandemic. Quite classical responses also in the Nigerian case. We saw measures that targeted businesses. I'm mentioning here the emergency stimulus bill just because it was targeted at the formal economy, while we acknowledge and know that like a majority of people in the Nigerian context operate in the informal economy. And also another thing that I want to mention here is really, again, the role maybe of the World Bank via its in private finance arm or private sector support arm, the International Finance Corporation, going and targeting banks in a first instance, again, weighing private finance, giving an importance even in this kind of situation. Just to briefly also mention some of the household support measures that were implemented in Nigeria. Existing cash transfer programs, which is part of the social protection infrastructure in Nigeria, were used and expanded, and we saw some of the school feeding projects. So COVID-19 didn't hit the world, and definitely also not Nigeria, Nigeria that was perfectly functional, but before the pandemic already, health and education inequalities, or inequalities more generally, were rampant. And I'm just giving some examples here. So the graph on the left, on my left, shows that like in more generalized terms, but like the poorer northern states of Nigeria are also the parts of the country that experience much higher under 5 mortality rates. So we see a regional inequality already here emerging. The same is true if we look at primary school net attendance. Again, attendance doesn't necessarily tell us anything about learning, but just to use one indicator here, we also see gender inequality built in. If we look at the graph that's showing us primary school net attendance, and then just to importantly mention class or income, if we look at the top graph, we see that like the probability for any child to survive up until its 5th birthday or even younger depends on whether you're born into one of the richer households or not. So again, COVID does not come and surprise Nigeria at a very nice moment in time, but at a time where it seems that the systems in place are already producing some of these massive social inequalities. Just brief, there's not much surprise, or we can explain, or there are theories, of course, that like explain these inequalities as they manifest and like are maintained in the Nigerian context as in other places. Since the 1980s especially, we have like this push for neoliberal social policy making, and really just to highlight a lot of the work that has been done on this, highlighting that like this wasn't always the case. This wasn't always the case. In many countries on the African continent, and especially in Nigeria, we would have seen a push in the 1950s, 1960s, especially after independence, 1970s, towards actual broad and much more broadly conceptualized social policy programs seen as an investment in citizens and as part of national development plans. Then in the 1980s, of course, we see structural adjustments. We all know the story, an introduction of user fees in many of the social service delivery sectors, a push for privatization. And here I just want to really emphasize that like this is still the phase we're kind of in. It's just like to speed it up, accelerate it, because now the dominance of private finance is becoming more and more important. But we see like a mix between a rhetoric for education for all, universal health coverage, which sounds nice and compelling. We have the World Health Organization, International Labour Organization, now like kind of agreeing with the World Bank on definitions and so on. But just to give the example of healthcare, right? Universal health coverage, which is a shift away from primary healthcare that was essential in the 1970s. So today, still, we see so much less focus on how healthcare is provided and how education is provided, and the focus remains on coverage. And I'm just saying this because I think it's important to mention this whole idea in the narrative. While we see a narrative, yeah, we need more public resources to finance and fund these social service delivery systems. At the same time, there's this massive push towards private finance, because we cannot afford to fulfill the sustainable development goals, including the goal on universal health coverage, without private finance. And so public-private partnerships are now being pushed forward as the new alternative and the new silver bullet. But again, very limited evidence of their advantageousness. And again, the push that like, perfect, yeah. The push, or like the evidence that's showing that like public and integrated universal healthcare systems fare much better. So yeah, the last 5 minutes really just to highlight how COVID now impacts these inequalities in the short run, but also what are the long-term implications of the pandemic, and if we lack, or if we not use an opportunity to break from a system that I consider flawed in the first place. So here just to show that like in direct consequence of the onset of the pandemic, we see an increase in socioeconomic inequality. In Nigeria, a lot of people derive their income from the informal sector, and like World Bank data collected with the National Bureau of Statistics in Nigeria shows directly that like in the couple of weeks after the onset of the pandemic, we see a decrease in activity and income, a loss in income. And I just also want to highlight here again this research by Abdallah and colleagues that has come out already, highlighting that it seems that women were more so affected by this loss in income in the direct aftermath of the COVID-19 pandemic. So just again, another inbuilt inequality that was exacerbated by the pandemic. In education, there's a lot on the slides. Just in brief, what we would see in the Nigerian context was some form of shift towards online learning. But again, who can access online learning resources depends on region, depends on household income, and so on. Research has found already that dropout rates remain quite high, even after, let me say, the worst of the pandemic is over. And again, gender inequality quite obviously being exacerbated during this crisis. The same is true for health. I mean, the most obvious might have been food consumption. Many households, or many people within households, started skipping meals. A strategy, unfortunately, that's common, but like was increased or more often employed during the pandemic. Again, a direct link to income here, with poorer households, of course, paying or spending a larger proportions of their income on food. But also in terms of like access to actual medical care and medical treatment, we see and reduced ability of households to access these healthcare services. And I'm just mentioning here that there's research already really highlighting how the dependence on having to import medicine has also aggravated medicine insecurity even more so. Oh, sorry, that was not too much. And just the last 2 minutes to highlight that the pandemic might, I'm not saying over, but like the direct impact of the pandemic might no longer be as drastically felt. But of course, COVID being seen as an external shock to a system that works has long-term implications. And we do see that in the Nigerian context quite clearly. The government's resources to fund its budget are still low. There are increasing poverty rates estimated. And again, we have to question how poverty in the first place is measured. So I'm just citing here the World Bank statistics. Food inflation continues to be on the rise. Food insecurity is a problem. And of course, there was a reaction to police violence that occurred during the pandemic, but already before, which led to NSARS violently put down by the government and the state. But still, we see an emergence of labor movements. Still, the new president in Nigeria came in and seems to have adopted pro-market reform plan, which makes me believe that the government in power is of the belief that like COVID was this external shock to a system that can deliver. In the first instance, we've seen the fuel subsidy removal, which led to a massive increase in the petrol price. The president removed and suspended the governor of the Central Bank of Nigeria, introduced a floating system for its currency, which led to the devaluation of the naira. We've seen energy market liberalization and so on, regressive tax reform. So it feels like neoclassical economics textbook. But the one thing that I really want to mention is the increase in debt, which was also highlighted already this morning. During the COVID years, so the graph on my right is really showing how the deficit was increased even further in a context where we already have seen an upward trend in terms of accumulating sovereign debt. And what does that mean now for access to healthcare and education and inequalities that materialize? Beyond the narrative and the rhetoric of universal health coverage and education for all, we do see a lack of public resources available. The debt service is a multiple of any of the resources made available for the healthcare sector or the education system. So it is really for us to carefully look beyond this narrative, because it seems that if we don't reconceptualize and like start thinking of like the inherent flaws with the capitalist system, that we are just again putting a plaster on something that is likely going to reoccur in a different shape or form. Thank you. Yeah.
To just invite Georgie for intervention.
Yes, you said so. Thank you, Chair. So you gave me 15 and then you reduced it to 12, but I will, I will try. I really am pleased to be part of this panel in this minor way, because it's showcasing work that has been done by scholars of the Codesria community on what I consider a very important matter, the lessons we learn from social policy in times of the COVID-19 pandemic. I think it demonstrates the kind of responsiveness to development challenges that Codesria is famed for. And while this is a drop in the ocean of the massive intellectual production around COVID-19 lessons, I think the particular orientations and approaches that the four studies have taken could be quite weighty in shaping policies and approaches to social policies for the future. So I really thank the panelists for this exercise. Yesterday in the plenary on grounding debates, which also discussed the history of research agendas of African scholars since Codesria was established, panelists drew attention to the important job of disrupting dominant narratives, but also the task of crafting durable alternatives. And I see this panel as one of those efforts to both disrupt and to point the way forward. And I'm gratified also that from a personal level, that it showcases some of the research from the Gender Equitable and Transformative Social Policy for Post-COVID Africa project. And this is a Pan-African research project that I'm proud to be a part of. The panel also speaks to efforts of another network I'm part of, IDEAS. IDEAS is a global South network of heterodox economists and social scientists who've been working to craft a different future for the global South by defining alternatives to the current neoliberal chokehold of economics. IDEAS is well represented at the General Assembly by one of its founders, Jomo Kwame, who was in the earlier panel, but also by its current executive director, Charles Abugwe, and Ndongo Silla, its Africa Programs Director. That said, I want to quickly go to the points that have been made in this panel. There are 4 common messages that I want to take from this panel. And this is not to say the papers are homogeneous. They present different emphases, but it's important to draw attention to 4 things that I think they all have in common. The first is the importance of how a problem, a situation, or an event is defined for the solutions put forward. As the papers show, this applies to us as researchers, but also to policymakers and activists. So Julia's paper on health and educational dimensions of social policy makes this point in demonstrating that the COVID-19 pandemic should be understood as a crisis of capitalism and its model of accumulation and its immiserating effects on working people, but also on its destruction of the environment. This is important because if we think of COVID-19 as an external shock, which is the dominant discourse, we think of solutions as those that might mitigate external shocks and return to business as usual. As we know from the tomes that have been produced about the COVID-19 pandemic, this refusal to learn its lessons and the return to business as usual that we see going before us is one of the greatest tragedies of our period. Similarly, on the question of the importance of problem definition, Kate Maher's point about the discovery of the essential worker and her pointing out that there are 2 ways in which these have been recognized is important. As she points out, they are either defined as workers that are necessary to the provision of essential services, which is mainly how essential workers in the formal economies of the global North are seen, or as workers whose work is essential to their own survival, which is how those in the informal economies of the global South are often seen. This insight draws attention to why the informal economy workers are considered in need of social protection to stay away from the work that they do. What I learned from this distinction is that had essential workers in Africa's informal economies been recognized as both essential for the provision of vital goods and services, but also as essential for their own survival, some of the draconian measures that were put in place because they were seen as vectors of the spread of disease would have been crafted differently. One of the questions I still struggle with, which is linked to this insight, is why land borders in Africa were still closed over a year after airports had opened to business in many African countries. The long-term effects of this on cross-border trade, on the livelihoods of millions of working people in the informal economy, and on African food systems is yet to be fully computed and understood. The second insight that I took from these 4 papers is how economic, social, and political conditions in the various countries, as well as the structures of their political economies, their social security systems, the levels of multidimensional inequalities and poverty are critical to understanding the kind of social policy choices they made and their effects. In Tekwe's comparison between Mauritius and Zambia, it becomes clear that Mauritius's reliance on a universal life cycle social security system made it easier for that country to weather the storms of COVID-19 compared with Zambia, which is the norm for most of Africa, where the reliance on market-based social protection instruments, such as targeted conditional cash transfers, necessitated more costly and also less effective efforts that many countries could not afford. The third insight is that all 4 papers have been exemplary in drawing critical attention to social policy instruments that became stars in the COVID-19 responses. And here I draw attention to 2: cash transfers and digital solutions. They point out the limitations of these instruments, but more importantly, their character in underpinning neoliberal social protection. All the papers draw attention to the limitations of cash transfers. Kate Maher's paper especially draws attention to digital cash transfers as a source of secondary exploitation within capitalist production systems. Secondly, all 4 papers speak of the digital divide as a source of inequalities in health and education. These insights call for more critical work to not only question the faith in digital technologies as the greatest promoters of access to education, to markets, to information, and to even healthcare, but also work which asks the question of how digital technologies can actually be useful and allow, in Kate Maher's words, all people to engage with the digital space as agents and not as victims. I think this is a very important question. The fourth insight is that all 4 papers offer ways out of the crisis of social policy in Africa. And the ways they do it draw attention to the need for fundamental changes in social policy directions, the rebuilding and building of new social policy institutions, and the transformation of and rebuilding of new social relations based on new social contracts. TEQUA, for example, recommends a universal tax finance social security benefits across the life cycle. Chukwuma points to the importance of centering social justice in thinking about social policy. Maher points to the need for policies that take actual vulnerabilities and infrastructural realities into account and needs into account. And Chipenda talks about the importance of reconciling state, society, and market relations and ensuring synergies between economic and social policies. I wish to fully associate myself with these 4 observations from the panel. If COVID-19 taught us anything, it was that the past, the present, and the future are all around us. That said, I want to raise a few questions for the consideration of the panel in order to push forward the discussions. So to Chipenda, I have the following questions. Your paper demonstrates that transformative social policy frameworks can be useful for assessing social policy. Beyond analysis and assessments, how can it actually help us to fashion social policy tools and implement them? Specifically in the case of Zimbabwe, you present some interesting innovations in the stimulus packages, particularly the focus on agriculture. And you could see that from the budget that was spent on agriculture. That said, what have been the actual outcomes of all these efforts? More generally, can a state which is steeped in the neoliberal paradigm like Zimbabwe is actually achieve transformative social policies while enforcing draconian measures? I was totally intrigued by your notion of unconscious commitment and unconscious efforts by the Zimbabwean state to achieve transformative social policy. How did this happen? How sustainable is this unconsciousness, and what would be its limits? To Kate, your paper draws attention to the damaging mischaracterizations of Africa's informal economies. While you are totally correct about the wrong predictions about COVID-19 deaths and informal economies, would you also argue that the analysis about the likely economic effects of COVID-19 on informal economies was also wrong-headed? If so, can you shed light on how this influenced social policy responses in Africa? Related to this, you were comparing Southern Africa and the rest of Africa, mainly in terms of size of informal economy, digital social protection, and COVID deaths. Is there any space in this analysis to take into account other factors, such as epidemiological factors, such as the level of immune compromised status, malaria infections, and so on? Recently, I attended an inaugural lecture by a colleague in the sciences who had a map similar to yours, but this time he was comparing malaria endemic areas to non-malaria endemic areas. And it seemed to be that COVID-19 had a greater effect on life in areas which have not experienced malaria very, very much. Lastly, you write approvingly about non-cash responses. However, studies in Ghana, even Nigeria, and several countries in West Africa have pointed to the hit and miss targeting of these instruments, how they exclude people in the informal economy, for example, the electricity and water subsidies that were offered in the COVID period, and also the attendant corruption and patronage that has come with these non-cash responses. To Julia, you speak of the importance of social justice to social policy. My question is that there's a remarkable consensus on this panel about that neoliberalism has been a disaster for social policy in Africa. Your paper in particular draws attention to the questions of inconsistencies between capitalist production and the protection of the biosphere and the environment. Given this approach, you draw attention to the challenges of achieving fundamental changes in social policy in these times of a return to excessive debt servicing and austerity. The figures you put out there were quite startling and concerning. So I wanted to push a bit on your call for a social justice approach. Are there social justice, social policy approaches that can undermine this chokehold of neoliberal economics and in social policy? What conditions would we need? What conditions would need to change to be able to move this forward? To Tekwa, your paper, I think, is convincing in showing differences between Zambia and Mauritius. My question is that the benefits for Mauritian women, which you discuss, treats women almost as a homogeneous category. Would differentiating among women complicate the picture that you've presented about gender equitable social policy in Mauritius? Secondly, has Mauritius's universal life cycle approach resulted in gender equity in the economic, social, and political spheres? I think I'll stop here in order to respect my chair. But I wanted first to congratulate the panelists on their contribution to disrupting dominant discourses and also offering building blocks of a new era for social policy and social justice in Africa. And I hope more of us can continue to do this work. Thank you.
Thank you very much. That's the value of having a discussant for a panel such as this. We've got 18 minutes to go. We're already 30 minutes if we finish on time into lunch. So you're the one standing between you and lunch. Okay. Yeah. I'll take, let me put it this way. I'll take five questions. And remember what I said, the housekeeping state, whatever the number of questions you have in your mind, help me reduce to just one. And keep your questions to within 30 seconds. I'll take the hand here, the hand here. Okay, so who's here? Yes, very much. 25 seconds.
Okay, thank you. My question is for Kate. Do we have a source of data about the amount of capital that has been invested or even potentially the rate of return for these big technological or digital interventions focusing on social protection? Who were the main investors and what was the amount of return, if there is any data that we can use to support the claim that you made? Thank you.
All right, thank you very much. That's a good start. One question.
Merci, Président, pour la parole. Un constat, d'abord féliciter les intervenants et leur adresser à tous une même question. Pourquoi? Parce que si je résume rapidement les mots-clés qu'ils tous ont utilisés, c'est d'un côté les inégalités, de l'autre l'informalité, et le dernier mot-clé, c'est la pauvreté. Je pose la question à propos de la pauvreté. Quel est, selon chacun d'entre eux, l'entendement qu'ils ont du concept de pauvreté, de sa mesure et de son utilité dans le contexte de politique de développement en Afrique? Merci.
All right, thank you.
Thank you very much, Mr. Chairman. Now I can be seen. My name is Henry Arineitre, and I come from Makerere University in Uganda, in East Africa. I have one comment, which is general, but I'm focusing it on Professor Clement Chipenda. And here we're talking about social policy and also inequalities. But you stated that social and economic policies should also be in tandem. Now, when you look at the statistics in Africa, you find that the GDP per capita has not been growing. And for Zimbabwe, for example, it has been around 1,200 there for the last 10 years, but population is growing. So since we're talking about social policy being in tandem with economic policy, is it possible for us in Africa to adapt the policy of almost zero population growth for the next so many years, just like China did, so that we're able to catch up and provide for the economic opportunities and growth and be able to contain these epidemics? Well, these epidemics are just symptoms, but there are many underlying things that come with the growing population with minimum economic growth. Thank you.
Merci et félicitations aux intervenants. Juste une question relative aux violences induites, à la recrudescence des violences induites par la COVID-19 dans nos pays. Est-ce que des statistiques sont disponibles par rapport à ces violences avant la crise, pendant la crise et en situation post-urgence? J'ai besoin vraiment de savoir parce que dans nos pays en Afrique de l'Ouest, on relativise cela. On pense que la crise sanitaire n'a pas induit une croissance, une recrudescence des violences, surtout dans les ménages. Je voudrais vraiment que des exemples soient donnés dans nos pays, surtout en Afrique, pour comparer. Parce qu'en Europe, c'est évident qu'il y a une recrudescence des violences, mais en Afrique, on relativise vraiment la situation. Merci.
Thank you very much. And the last question for this round, if we, yeah.
Thank you very much. I think Georgie nailed the question that faces us today in terms of what appears to be the collective amnesia that we tend to have on these issues, to say that actually COVID was a mirror in terms of what society is like. So in some of our countries, it was more of the response to COVID than COVID itself. We had people being shot at to actually save them from COVID. So just crossing a border of a district and somebody is shot because the military response was more amenable to what the sort of current politics is in terms of response to predicaments. And so one would ask, how are we engaging with the question, for example, of the neoliberal agenda on the several questions that we have as Africans? And that also relates to even the gender questions in terms of what do we learn? What are we doing with all this information and the fact that COVID-19 helped us to now get to the bottom of what our society looks like? Thank you.
Thank you very much. I'm really proud of everybody, I'll return to the panelists, and I'll go in the same order in which they made their presentation, and I will have to restrict you to 2 minutes per response. Pick any of the questions and pay attention to Georgie's questions, because she had more time to reflect on your papers and so on and so forth. Thank you.
Okay, thank you very much, and thank you, Georgie, for those really penetrating comments. I would like to start with a very quick reflection on Georgie's comments about how COVID did it possibly affect people's incomes more than it affected their lives? But the whole issue that affected incomes, yes, many informal people were badly affected by COVID, but not by COVID, by lockdowns. Still can't hear? Okay, is that better? People working in the informal economy were badly affected by lockdowns more than they were badly affected by COVID. In places where there was locking down, they couldn't work. In the stats on Nigeria's loss of income in the informal economy were over the month of lockdown across the month of March and early April. So lockdown was a problematic policy in a place where COVID wasn't all that serious and where activities were being carried out in the open air. Inside offices, possibly a problem. In the open air, less so. So I think the key issue is looking at the conditions in which COVID is having an effect and how people are affected and how their incomes can be protected, not by locking them down, but by supporting them, encouraging social distancing and working in open air environments safely. And similarly, the epidemiological issues, I think there are fascinating issues there that relate to the way that a lot of the COVID statistics are crunched, which have to do with reading Western epidemiological ideas into the African data when lifestyles, underlying health conditions, epidemiological conditions are very, very different, so that your chances of dying of COVID are not the same in Senegal as they are in Spain because of these differences. But none of that is reflected in the policy. What was handed over social policy-wise was a gold standard template from the West, lockdowns, digital cash transfers, which actually served to increase rates of death for the reasons that I explained rather than to reduce them. So I think the the issue of how much money has been spent badly to create these digital systems, I think that's a big project for somebody to carry out. That will be in state budgets across spending across a number of digital providers and financial systems to look at how much it has cost, say, to put together Togo's Novisi program relative to the amount of protection that was actually delivered. So I think there really is a mismatch between the huge cost of these programs, digital programs, and the actual support needed and how that money could have been spent better in a context in which many more people die of malaria every year than died of COVID. Health priorities, was COVID the biggest priority in Africa? From the statistics, I don't think so. Perhaps in some ways, the cut and paste policies made more people die of COVID than would otherwise have died. And the last thing I want to say is to connect this with the issue that Bayo raised about Africa creating its own agenda for Africa and for social protection, rather than taking on the gold standard best practice social policy approach to COVID for the informal economy, for social protection for the informal economy. Transformative social policy needs to be updated and expanded to reflect the realities of the contemporary world. Tandika's idea of transformative social policy, I think, brought great insights to how social policy can advance development, but it has a national framing and it focuses on production. And it needs to be adapted to a situation of globalization and digitization and financialization in the economy, and in understanding how social policy can actually transform precarious livelihoods and improve them rather than maroon people in lockdowns or waste money on unnecessary social policies that never reach them.
Okay. Thank you, Georgie, for the comments and also for the questions. And I find it interesting that our papers were actually speaking to each other on many aspects. Maybe I want to first refer to the issue of maybe the support in agriculture or the support in the social policies that came about, which I think I would argue were not conventional approaches. And it's an issue that I think I've been working on because currently I'm more into agrarian studies. So when we look at the support that was given during the pandemic, it's interesting that there was that aspect in which agrarian support was actually provided to smallholder farmers, communal farmers, and also people in the urban and rural areas. And I think that highlights one of the aspects that we are looking at the research chair, in which we are looking at land and agrarian reforms, agrarian support as being one of the overlooked vectors of social policy. And for my PhD, I think I actually looked at that aspect. And you find that it's something that is not really acceptable because people will be questioning, how can you talk of land or agrarian reform or agrarian studies in the context of social policies? Because I think the idea has always been that social policy should be social welfare, should be social protection, should be talking about pensions, health, etc. So I think the COVID-19 dynamic actually brought out that aspect that you can actually be supportive to your population, not necessarily by giving them handouts, but actually by trying to enhance their productive capacities. So you find that unconsciously, the Zimbabwean government, I think it did actually do that, although maybe they didn't think it in terms of actually being a social policy intervention. And also, maybe I would like to highlight that when we talk about the tandem between social and economic policy, we are not saying that we should stop reproducing, we should continue reproducing. But the idea is that when we look at social and economic policies, they should go hand in hand. As it stands now, you find that economic policy used to seem to be superior to social policy. But I think COVID-19 has actually brought out the fact that social policy is indeed important. And economic policy should actually support production, social protection, and redistribution when we look at social policies. Thank you.
All right, thank you very much for the questions, Prof. I think I would ask Ramola, who was one of the researchers who was focusing on Mauritius, to respond to the questions on the possible preventive effects of the COVID-19 on Mauritian women. Then maybe after 1 minute, then I would respond to the question from Prof. Aikire on neoliberalism and social policy.
Sorry, just to avoid disrupting the process, you respond and then they can give her the mic.
Okay, that's fine.
No.
I think as we have highlighted in the concluding remarks that there is actually a need for a ideological shift in the paradigms in which we formulate our social policies from a mainly neoliberal framework where most of the countries or most of the social policies are towards minimalist approaches. Then in try to shift to more expansive and actually an increased role of the state in social provisioning. I think Julia pointed out that beginning maybe in the early post-independence period, most African governments tried to invest much in education and health, but that tends to change with from the 1980s onwards with the ideological shift in much of the approaches to economic and social policy, where we see most governments instituting mainly neoliberal policy, social policies, which tend to reduce government spending on social policy. Thank you.
Yeah, so in 1 minute, I'll just say that the study, we looked at the broad overview of policies, and I would like to stress that in Mauritius, definitely, it's not a homogeneous category of women. But for that particular study, we were not able to differentiate the different group, to do a specific study of the different groups, but it looked broadly on what policies were adopted and how this most particularly touched on the lower income groups. So that was the broad focus. So I think that will be my 1 minute.
Yeah, I feel the pressure. No, thank you. Yeah, just maybe to briefly say thank you first for the questions and the comments, and to answer 2 questions quickly. So what approaches, how can we get to a social justice approach, of course. I do think it takes us back to like what we've maybe already learned if we look into the 1970s. We need a new international economic order that's different. As the terms of trade stand at the time and the power relations, I don't think this works. But there are alternatives that are already being discussed. And you mentioned Ndongo Sambasila at Ideas, and he's very clear that like we can explore alternative economic policies such as modern monetary theory and so on, to like maybe reconsider. Maybe we actually don't need to frame demography as the problem on the African continent, but we can use all the human resources here to build the things we need and to provide the services we need. And just the second point, maybe poverty. I personally think, of course, the framing of poverty is not useful. It is being used by the World Bank to drive a certain narrative. Arbitrary line of 2.15. Does that mean like a person having more than that is not in poverty? It distracts from a broader discussion of like structural transformation, which is what we need, and focuses on a neoliberal way of like making marginal improvements and being used as like by Bill Gates putting it on Twitter saying that this is a success story. So I do think we need to push back
No, it's okay. No, sorry, no interjection.
Okay. Thank you.
All right, okay, thank you very much. We're 3 minutes into lunch. Okay, so there's still 1 hour, 57 minutes. Oh, is it 1 hour or 57 minutes? But let me just thank, the panelists for an excellent work, and to thank Georgie for an excellent, overview for some of the projects. These are things that we will take forward, and to thank you for being an excellent audience. So in a way, this is a win-win situation. It's not a neoliberal winners and losers, something like this. For those who have more questions to ask, we have 4 more days to go, or 3, 4, today plus today, and you can apprehend them, anywhere, anytime, not after 6 p.m. Thank you. Okay.
Prof, thank you very much for being such a good chair and making my job easy. I just have 1 or 2 housekeeping announcements. The first is if you are struggling with Wi-Fi, please speak to the colleagues, the technicians at the back. Secondly, we are having lunch now, and lunch is taking place in the same room we had lunch yesterday. It's downstairs, 1 floor down, Sal Adrano.